This is Amber Weaver's informative speech. This is my audience. And Celia will hold it.
Have you ever missed work or school due to a hangover? 90% of adults in the U.S. have had an experience with alcohol. And a high number, 60% of males and 30% of females, had one or more adverse life events dealing with alcohol, such as missing work or school and drunk driving. The good news is most people learn from their experiences and change their drinking habits. Others become alcohol dependent. Alcoholism includes the following 4 symptoms: craving, loss of control, physical dependence, and tolerance. We'll discuss 3 different things today: the causes, effects, and treatments for alcoholism. First, we'll discuss what might cause or put a person at risk for alcoholism. The family plays a big part. It's been estimated that 40 to 60% of the risk for alcoholism is from genetics. The research is ongoing to figure out what genes could cause or put a person at risk. Also, drinking at a young age. According to a survey of 43,000 U.S. adults that appeared in Archives of Pediatrics and Adolescent Medicine, drinking at a young age puts individuals at greater risk of alcoholism. Early alcohol use is also associated with developing dependence more quickly and at a younger age. Out of the 43,000, 47% met criteria by age 21. Also, the ones who started drinking at 21 or older had a 9% chance of dependence. Each year younger that they started drinking, the chance went up. If they had started drinking by age 14, 47% experienced dependence. Early drinking is also associated with longer duration and a wider range of symptoms. A 2005 Youth Risk Behavior Survey conducted by Centers of Disease Control and Prevention found that 26% of high schoolers had drank alcohol before the age of 13. Other causes: cultural attitudes, acquired personal experience, stress, availability of alcohol, and being a male. The ratio for male to female alcoholism can be as high as 5 to 1. Now that you know what might cause alcohol dependence, how do you think alcoholism affects individuals and their families? There are many physical and harmful effects on the body. Nearly every organ system is affected by alcohol, including the gastrointestinal tract. You can have gastritis, stomach ulcers, and cancer of the esophagus, stomach, or other cancers. There's also a 15% chance among those who use alcohol heavily of liver cirrhosis and pancreatitis. There also affects the cardiovascular system, the central and peripheral nervous systems as well. Here you can see brain scans that are from Amen Clinics. Here's a healthy adult brain. This is the top, this is the bottom. And here's a brain that's been affected by alcohol, heavy alcohol use, the top and the bottom of the brain. Where you see the holes in the brain, that is where there's lack of activity going on in that part of the person's brain. There can be cognitive deficits, memory impairments, degenerative changes in the cerebellum, which can cause an unsteady gait. It affects the balance. Other effects are low-grade hypertension, heart disease, insomnia, and a suppressed immune system, which can cause infections and a greater risk of cancer. Other risks include accidents. There's a photo here. 55% of fatal driving crashes involve alcohol. Also, violence. 50% of murders occur when the murderer and victim are intoxicated. Also, it can affect responsibilities in professional life. You will be absent or late to work. Accidents can happen at work, and there can be low productivity due to alcohol. Alcoholics are not the only ones affected by this disease. Family members experience a lot of pain and sorrow as well. Children of alcoholics can experience low self-esteem, guilt, fear of abandonment, depression, anxiety, and stress. And they're also at a greater risk for developing alcoholism themselves. Also, alcoholism can affect marriage. There can be poor communication, anger and distress, reduced intimacy, finances, such as a lot of money spent on alcohol or job loss from alcoholism, and also abuse. 2/3 of domestic abuse cases are due to alcoholism. You now know what can cause this and what it does to people. But can it be treated? The answer is yes. There are many different kinds of treatment. One is our self-help programs, such as Alcoholics Anonymous. I have a aid here. Alcoholics Anonymous and self-help programs should be used along with professional help. There are two different kinds. Psychosocial therapy, which can include motivational enhancement therapy, couples therapy. The use of a non-alcoholic spouse can greatly increase success in treatment. Brief interventions, which are straightforward talks giving information. It's usually from a physician or a nursing staff. And also using alcohol and nicotine treatment together can be very effective since they can be related. We have different medications that we use in treating alcoholism. One is naltrexone, and it acts in the brain to reduce the craving for alcohol. We have acamprosate, which reduces symptoms of lengthy abstinence, such as anxiety and insomnia. We have disulfiram, which discourages people from drinking by making them feel sick after they drink. Other medications help manage withdrawal. With any medications, there can definitely be side effects, and they should always be used with the psychosocial therapy for better success. As you can see, alcoholism has many causes, effects, and treatment options. Alcoholism or alcohol dependence is a disease. A person's genes and lifestyle can put them at a greater risk for alcoholism. Alcoholism is chronic, meaning it can last a lifetime. And it has many harmful effects on a person's body, mind, lifestyle, and family. There is no cure, but we can use self-help programs, psychosocial therapy, and medications to treat it. With 90% of adults having experienced alcohol, drinking is a norm in our society. Being aware of what alcoholism is, what it does, and what puts you at risk is very important when deciding to use alcohol. We can't control our genes, but we can make wise choices about when and how much alcohol to use. What will you do to prevent alcoholism in yourself and others?